Bev, will we get to see how many people are in the audience? Oh, yeah. Okay.
So if you look down at the bottom where participants is, you can see them coming in.
Perfect.
And your screen is not in the presenter mode.
Okay. So let me switch to that then.
And also down at the bottom where the Q&A is, people can ask questions there.
Perfect. All right, I'll make reference to that when we get started in a minute. All right. Hello, everyone. It's just a minute after the hour. So just in the interest of time, we're just going to get started. So good afternoon. My name is Raja Narayan. I'm one of the surgical oncology fellows, and I'm a member of the Residents and Fellows Education Committee for the SSAT. So let's dive into it. So today we're going to be talking about how to prepare for the general surgery boards, and we have an all-star cast that's here to present for you today. So I'm just going to go through some quick details about the SSAT and get us set up with our speakers for today before I turn it over. I mentioned that I'm going to be our moderator, so I'll be helping to sift through. And just briefly about the SSAT, this is an organization that was founded in 1960 that was first the Association for Colon Surgery. The mission for our organization is to lead in the advancement of the science and practice of gastrointestinal surgery. And our vision is to unify a global community of GI surgeons advancing research, innovation, and advocacy to benefit the interdisciplinary patient care. So there are different ways to join the SSAT. For you all here, you're likely candidate members if you're residents, incoming fellows, but if you'll be an attending or faculty next year, you'd be an active member, which I've shown some of the fees here. And there are a lot of benefits associated with joining the SSAT, like I'll talk about in a moment. Or if there are any medical students on the webinar today or interested that you know of, they also can join, and we have a lot of resources for those individuals as well. The resources that are involved include benefits like having access to issues of the Journal of GI Surgery, discounts when you attend the Digestive Disease Week, where the SSAT is a member of, and there are a variety of different awards, grants, scholarships, and travel funds that are at your disposal once you're a member of the SSAT, as well as leadership opportunities to get involved with the society and to network with other surgeons in the greater academic community. And there's a special residence corner as well that has a variety of resources for us that you can see listed out here that's available at the website that I've shown here. And we'll have a copy of these slides available for you after the talk as well in about 1 to 2 business days. As I mentioned here, we'll have a copy of the full recording as well. So you'll receive an email that the recording is available online, and you'll be able to see it on the YouTube channel. But if you're more of the audio learner format, you can also access it as a podcast as well, wherever you access podcasts, by looking for the SSAT Sound Bites, a podcast series. And I just want to thank the organization as well as the Resident and Fellows Education Committee for helping to organize this, including our committee chair, who's Dr. Maria Altieri, and our vice chair, Dr. Zivan Fong, who helped us organize this. And can't go without thanking Bev Hendry as well, who's our director of administration that's helping run things today for us too. So as I mentioned, we have an all-star cast today that's going to be talking to you about how to best prepare for the general surgery boards that we've arranged experts from all different divisions and different institutions around the country that we're very fortunate to share their knowledge with you. And so I'm going to stop sharing here. Perfect. And so the first person I want to turn over to is Dr. Mary Hahn. I have the privilege of introducing her. She is the Emil Holman Professor and Chair of Surgery at Stanford University. She completed her general surgery residency training and a master's of public health at the University of Michigan, as well as a minimally invasive surgery fellowship at Oregon Health and Science University. She's the chair of the American Board of Surgery, the secretary of the American Surgical Association, the immediate past president of the Halsted Society, president-elect of the Association of VA Surgeons, the first vice president of the Western Surgical Association, and treasurer of the James IV Society. She's a member of the editorial board for the Annals of Surgery and an associate editor for the Journal of the American College of Surgeons. In recognition of her scientific contributions and achievements, she was elected to the National Academy of Medicine in 2021. So her presentation for us today is titled QECECCA, Decoding the Alphabet Soup of ABS Certification. Dr. Hahn, why don't you take it away?
Great. Thanks so much, Raja. Just checking people can see my slides and hear me. Okay, perfect. All right. Well, I'm thrilled to talk to you today about a process that I think is incredibly important for our profession. And I will disclose that I am the current chair of the board of directors for the American Board of Surgery. So obviously I've drunk the Kool-Aid and think that certification is really important for not only for our profession, but for our patients and for the public. So I'm going to go through how do you become a certified surgeon, and go through a little bit the qualifying exam, certifying exam, continuous certification, and what all that means. So the qualifying exam is the first exam that you will take beyond the in-training exam. So the American Board of Surgery in-training exam, which is what ABSITE stands for, is an exam, if you're all residents right now are quite familiar with. It's an annual exam. It's supposed to be a formative exam, meaning to see how you're progressing in your knowledge, give you feedback on areas where you might not have as much exposure or knowledge of, and across the broad core curriculum of surgery. So the qualifying exam, on the other hand, is a high stakes exam. It's about 300 multiple choice questions, and it's given in 4 blocks, similar to the ABSITE. It's only offered once a year, annually, and in July. And several years back, the House of Surgery made a decision to move fellowship start dates after general surgery residency to August 1st to give the candidates time to move and prepare for their exam, because we were seeing kind of unexpected high fail rates, especially people going into super intense fellowships like transplant or cardiac surgery, things like that. So we moved the fellowship date back in order to give candidates a better time and window to study for and to take their exams, and decompress that time. So that's when the qualifying exam is done. It has to be given, it's taken in a secure location, so usually a Pearson testing center. Feels a little bit like going to prison. You have to put all your cell phone in your locker. They securely check you. And if you haven't, it's been a while, probably since you've taken a secure exam. And the goal of this exam is really to assess your knowledge. And it's mapped to the SCORE curriculum. So that's a good resource or reference as you're studying for this exam. And how you perform on your ABSITE exam is a kind of a good guide for how you can expect to perform on the qualifying exam. So the criteria to sit for the qualifying exam, you have to be at an ACGME or Royal Canadian Physician, not sure what the SC stands for, accredited residency program. You have to finish your training in 7 clinical years. You have to meet all the requirements. You have to have had ACLS, ATLS, as well as the fundamentals of endoscopic surgery, fundamentals of laparoscopic surgery, and submit a case log. You have to be in good standing in your program, and you get a total of 4 opportunities to pass the qualifying exam in a 4-year period. So recently, we noted that several candidates were meeting some of the requirements to sit for the qualifying exam following their PGY 4-year. So in July, their PGY 5 clinical year, and started a pilot, and then offered this as an opportunity to sit for your qualifying exam after your PGY 4-year. And I actually really encourage our residents here at Stanford to take advantage of this. I think then that opens up that July, if you're traveling for a fellowship, to move and not have to worry about taking an exam in the middle, maybe do some traveling or something, you know, see some family, things like that you haven't been able to do as a busy surgery resident. So in order to sit for it after the PGY 4-year, the same requirements, you have to be at an accredited residency program, meet the requirements except for the case log. You have to be in good standing. And you have to have an exception request from your program director, basically saying that they agree you're ready to sit for your qualifying exam. And then you still have to just do a couple things at the end of your PGY 5 clinical year in terms of turning in your case log, making sure you get your final program director sign off, et cetera. Make sure you meet all the requirements for the qualifying exam. And if you fail that qualifying exam, it does count as one of your chances if you take it after your PGY 4-year. once you pass a qualifying exam, you're still not certified, you're still board eligible. And the certifying exam is the final exam to certification. It's also a high stakes exam. Many of you have had some experience with this in terms of a mock oral setting, but it's offered in the fall and the spring, and you must register for one exam only. And you can only take one exam a year. The virtual oral format we transitioned to in the pandemic, and we're pretty sure we would stay with this format. That's our commitment. We think it works very well for the candidates. It's not such a intense setting for them. But still, we have to maintain that it's a high stakes exam. So there's proctoring for security. There's a lot of steps you have to go through in order to sit for this exam virtually. And the goal of this exam is to assess judgment. So we're not kind of trying to, question and see if what, criteria, stage something is, some type of, criteria for a certain disease. It's really wanting to, like, talking to a colleague, like, hey, I've got this case. How would you manage it? And what would you do if this happened or that happened? And what if this complication develops? How are you going to handle that? So it's really, wanting to really assess judgment of the potentially certifiable surgeon. So it's 3 30-minute sessions. Each session has 4 questions. Everybody who takes an exam in a certain block is going to get the same questions. And there's 2 examiners for each room. So it's about 7 minutes per question. Your examiner might switch from one question to another abruptly in the middle of your answer. And it's just making sure we get through most of the materials. It doesn't mean you have done anything right or wrong in that question. And with the certifying exam, you get 3 opportunities to pass within 3 years. Once you become certified, then you enter into a process called continuous certification. And we've made major changes to continuous certification in the last years. And I think we'll continue to make changes to this process of how we continue to assess the surgeon in practice. So once you pass your certifying exam, you are a diplomate of the American Board of Surgery, as long as you have an unrestricted license. And you enter continuous certification. Then continuous certification, you have an every other year exam. And I'll talk about the exam a little bit more. You have to show evidence that you're involved in some type of practice improvement at least every 5 years. Every 5 years, usually you have to have letters of recommendation and you have to submit a case log. But we're looking at the last 2 items here, and that's why I put them just kind of in a lighter shade, because I think they may go away. We don't really do much with that information. And it hasn't been very robust in terms of identifying issues with surgeons in practice. So the continuous certification assessment, I would say it's a high stakes exam, but it's more of a formative exam. It's 100% online, and it's 40 questions. So a mix of core and specialty practice specific questions. So for me, I can take 20 questions of core and 20 questions of GI surgery. You could do 20 questions of core, 20 questions of general surgery that might have more trauma, acute care surgery type things in it. And you use your own computer and you just kind of log on to register for it. And once you start your exam, you have 2 weeks to finish it. And all the references for the exam are made available on the American Board of Surgery website. And so you could take 10 questions in the exam and say, oh, I just got called to go to a case. I'll have to come back and finish the exam later. And so it's open book. I mean, you can be Googling the answers to the questions, and each individual question isn't timed. And it's, so it's very interactive. So the first time you go through, you need 80% correct to pass this exam, but you get 2 chances. So the first time you go through, you have to get at least 40% correct. If you just kind of blow through it, knowing you'll be able to get back to the questions and you get less than 40% right, you fail. So you want to be a little careful about it. But if you get 80% right, you pass and you could, if you wanted to, go back and look at the questions you missed, or you could just be done and you pass. And so it's, but I would say this has been incredibly well received by our diplomates. Oops, sorry, I guess that's my last slide. I was going to thought it might show some data. It's highly, like 98% of people pass this exam versus the CE exam. The certified oral exam is probably somewhere around 88 to 92% of people pass. In the qualifying exam, the pass rate's about the same, 85 to 90, depending on the year, for all takers. So that's a little bit about the tests, the assessment, the purpose of them, and how the American Board of Surgery feels like it's our duty to kind of protect patients and the public, and ensuring patients have access to high quality surgeons. So thank you very much.
That was great. Thank you so much, Dr. Hahn. And as somebody that got the opportunity to take the QE exam at the end of PGY4, I highly encourage folks, if you have the opportunity, to definitely do that. It definitely takes the burden off at the end of PGY5, and it's good to get the start. So we'll have an opportunity for questions at the very end as well, if you have any, but we're going to start moving along to our next speaker, and that's going to be Dr. Kevin Pei. So he is the Adjunct Clinical Associate Professor of Surgery at Indiana University and the Associate Chief Academic Officer at Parkview Health. He completed his general surgery residency training at George Washington University and his fellowship training in surgical critical care at the University of Hawaii in Honolulu. He's the program director for the general surgery residency program at Parkview Health, and we're very lucky to have him present on what to do if you fail the ABS exams. Take it away, Dr. Pei.
Great, thanks so much. I wonder, can you all see my screen, or should I probably have to swap the screen?
We can see it. We just need you to go to presenter mode. Great. Perfect.
Good. Great. Yep. Thanks so much. Thanks, Raja, for having me. And it's great to be back actually with this the SSAT webinars. I always know this is one of the most popular webinars for the audience out there. I get to talk about something that we probably don't want to have to face, but unfortunately the statistics bore out that every year there's going to be some folks who don't pass either their qualifying or certifying examination. And I want to give really more of a message of hope and plan, because it does happen, and it happens to the best of us. And so hopefully in the next couple of minutes here, I can give you some tips and tricks about how to address that should you face that situation. So, getting that letter from the American Board that says that you were not successful and achieving certification or passing your examination, either of those exams, it can be a gut-wrenching experience, because for sure it's going to be a gut-wrenching experience, especially in our field of high achievers. You've done so well for your entire residencies and all your medical schools to be able to get into a competitive specialty like surgery. So we know that not achieving something is something that is very foreign to the vast majority of folks in surgery. And then when you get that letter, it often feels like you're by yourself, and as this picture sort of shows, you do feel like you're in this dark tunnel, and you're trying to climb upwards and not exactly sure what to do. And I think it's really, really important at this point to remember the context that you are, by just statistically alone, you are not alone. You are not alone in this, and that others have, unfortunately, have experienced this. But I think from those experiences come a wealth of knowledge and information. And I think some of the tips and tricks that I'm going to show you in the next few slides really comes from the years of working with residents and trainees and colleagues who have had these experiences and have overcome and achieved certification. So I think, let me start by saying there are some really, really important reminders of don'ts. I would say that all of us probably know some of the most competent, patient-centered, wonderful surgeons with excellent technical ability and bedside manner and clinical acumen don't pass the examination. So first and foremost, don't question your intelligence. Don't question your clinical ability. you were signed off to be able to take this exam by your program director, but because you met all the requirements for the board certification. So don't question that. The other thing that I know, it's easier said than done, right, is not to compare yourself to your classmates or other chief residents. And this thing, I know that, of course, I did it myself, so it sounds a little hypocritical to say don't do this, but don't beat yourself up about going over these scenarios in your head about 100 times. Everybody talks about, well, how did you answer this question? But the reality of it is that, especially particularly in stressful situations, you will have infused significant recall bias. We're going to tend to remember things not necessarily the way it happened. And I actually question how helpful that is. Surprisingly, there is no study out there to suggest how much recall bias there is, or the sort of the utility of running through these scenarios after the examination. But anecdotally, I would say that you probably create more stress to yourself than it's fruitful. And definitely don't call the American Board of Surgery to ask them to change their mind, because it's not going to happen. But I think it is important to remember to take a deep breath. And to own areas of improvement. Again, I talk about this concept of recall bias. We tend to remember the questions that were difficult for us, the scenarios that were difficult for us, but we also, in the same vein, tend to forget what areas actually needs improvement. And then it's also important, I think, to remember the big picture. This is but a small blip. I know it's a high stakes examination, but like Dr. Hahn said, you get multiple opportunities, because I think the board recognizes that even in the most perfect situation that some folks aren't going to pass, but with practice and another opportunity, they usually do. And so I think you're going to ultimately be awesome, and your career will be very bright. This is not going to stop you from achieving your ultimate career aspirations. And I think it's important to share with your family and friends, but I think most importantly, after the moment sort of panic and gut-wrenching emotions towards this, is to really have a plan of action. And I'll share a little bit of experience about residents that we have worked with who were not successful, and sort of what the advice that we give them. The first thing is maybe take a little breather and take just a little bit of time, and to have a moment of calm and peace away from the exam, especially when emotions are raw. And the brain is very racing a mile a minute. It is very difficult at that point to concentrate. So instead of trying to study right away, maybe take a little bit of time off and step away from the scenario. But ultimately, I think the most important thing is to have an intentional plan in place, a plan of action. And one of the first steps that I would take in implementing your plan is to take a look back at how you prepared for, whether it's the certifying exam, the qualifying or the written exam, or the oral exam, whichever step you were unsuccessful in. I would look back at how you planned, how you studied, or how you prepared, and maybe tweak some of those things that may not have optimized the time. I think that the most important thing isn't even necessarily the material that you study, and I'll throw out some of the resources that are available for you. At the end of the day, I think you really do need to set some time aside. So this can be tricky, right? Because you're either taking it right between your, right between the end of your graduation and your fellowship start, or you're taking it in the middle of your fellowship. And worst off, some of you are trying to take it your first year in practice. So you can imagine the amount of things that you have to juggle during that period. And so especially if you're not successful in the oral examination or the certifying examination, I think the most important take-home message is you have to talk to your partners, you have to talk to your organization, and make sure that you can take time off, dedicated time off to study. Let me address the qualifying examination for a moment and the resource that's available. I always get this feedback, and I think personally found this is one of those most durable, I think, study materials that's withstood the test of time. We use CSAP. I don't remember what version it was when I was a resident, and they continue, and CSAP 18 is the latest version of it. I mean, if you think about the things that are highlighted in a product from the American College of Surgeons, as well as the SCORE curriculum, recognizing that the American Board stays true to those topics that are being covered in both CSAP as well as American College of Surgeons, you already know that this product is going to be high yield to you. No, you're not going to get the exact question, obviously, but the material is high yield in the sense that the framework of the exam is based off of these resources. And I think that is a really helpful resource. SCORE curriculum. SCORE is doing a wonderful thing, which is allowing graduates continued access beyond the date of their graduation. I think for all the program directors in the country, as well as the graduating chiefs, that's wonderful news, because you continue to have access to the framework for the certifying examination. If it was the oral boards or the certifying examination that you were unsuccessful in, I'm elated to see that the American College of Surgeons has put out their product for a comprehensive general surgery review course. I think they actually just recently made a call out for those who want to register for this course. And this is the next slide is the only slide I'm going to present about data, but I think many of you may have heard this before. A study that was published in Surgery in 2015 that basically said that it doesn't matter if you take a review course and it does not correlate to your passage of the American Board of Surgery certifying examination. And I would say that looking through the literature, even as late as today, just to make sure that I'm up to date with everything, there was one systematic review that was not surgery specific. And I think the message is the same, that whether you take a review course or not isn't necessarily correlated with an advantage or passage of your certifying examination. I would have a caveat. I would just have a caution to the interpretation of those studies, especially in the setting of you being unsuccessful with your first try at the certifying examination. And the reason for that is because I think it's great to always hold a mirror to yourself and to see, oh, what are my areas for improvement? But I really think it's really, really beneficial, especially if you're not successful, to get some outside perspectives and to be part of a community of your colleagues and peers who are also facing the same challenges. I'm not partial to one course or another, whether it's the American College of Surgeons course or the Roland Review course, which I've had the benefit of being a faculty member on. This is a group of volunteer faculty, all teaching faculty at academic institutions who in a very intensive weekend course, or sometimes a little bit longer than that, that go over not just the content, which is really important in the delivery, but also communication skills, and you get lots and lots of feedback. And I would say that no matter which course you take, the two main benefit from taking a course, if you're not successful in passing, is number one, it's actually the time that's set aside. Now you have nothing else to do. You can't be on call. You're there and your mind is focused on it. But also equally, and maybe more important than that, you get an outside perspective. It's an outside perspective of areas for improvement. Certifying exam practice do's and don'ts. I want to point out, and I'll wrap up shortly after this. So when you're practicing for the certifying examination, I think it's really important, particularly in the virtual setting, to simulate the real thing as much as possible. Get dressed in the suit or whatever, in the outfit that you're planning on wearing during your oral boards. It's gone virtual. It's brought so many benefits to that, I think, to the examinee particularly. But I would not underestimate how uncomfortable one can be if you don't try to be in your attire, the camera, the lighting, the chair height, and just to get a sense of what that environment feels like. I would also practice saying out loud the scenarios as opposed to saying it in your own head, because there is a difference between practice saying your scenarios out loud. It's even better if you have a partner or a friend or a peer who's about to take this and you can practice together. I think this is age-old advice. Review major operations, because it is the American Board of Surgery examination. So you saying you haven't done this before is not a reason to not understand the major, at least the steps of an operation. And I would say something that I think is helpful to folks that I've worked with as well as myself is prepare a script for yourself, right? It's not a secret what the different body systems and the diagnoses that are going to be covered. I mean, they're the bread and butter and the common things that we all encountered in general surgery residency, right? So create yourself a script for these common topics that come up and say, well, what would I say in these, 6.5, 7 minutes? The other thing I would say during your certifying exam practices, especially at your institution when you do mock orals, stay true to that 4 questions, like Dr. Hahn said. Stay true to the 4 questions in your 30 minutes, right? Don't go off on a tangent on these mock oral practices where you're doing a complete history and physical, because I don't think that the examiners really want to hear 3 minutes of you trying to get a history from the patient. It's also probably not, especially on your second try, probably not very high yield or fruitful to try to read a 2,000-page textbook at this point. And I would say that maybe the worst thing to do is to procrastinate on practicing, whether it's your first time or if you're unfortunate and have to do it again. And I would say that try to study while working is a very, very difficult thing to do in the best of circumstances. And I think hopefully you joined a practice, whether it's a university or a private practice, that your partners would be understanding. And I'm certain that they would want to make sure that maybe, they can help you backload your schedule a little bit so you can have some time to study. And I'll end with this message is that, you're going to be able to do this. It's just a little blip in your journey, and there's no doubt that you'll be successful. Thanks a lot for having me.
That was great. Thank you so much, Dr. Pei. Really appreciate your time. All right, we're going to keep things moving here. So our next speaker is Dr. James Lau. So we're fortunate to have him. He is the Vice Chair of Education, Professor of Surgery and Medical Education, and Division Director for Minimally Invasive Surgery, Bariatric and Community Surgery at Loyola University Medical Center. He completed his general surgery residency training at Indiana University, then served as a flight surgeon in the U.S. Air Force before completing his fellowship training in minimally invasive bariatric and robotic surgery at Stanford University. He received his MHPE from the University of Illinois in Chicago. He is the current chair of the clerkship committee of the ASC, co-chair of the curriculum committee of the ACS Accredited Education Institutes Consortium, and a member of the ACS Academy of Master Surgical Educators. His presentation is on the nuts and bolts of preparing for the qualifying exam. Thank you, Dr. Lau. Take it away.
Perfect. I want to thank Raja and the SSAT for asking me to do this webinar again. And I want to make sure if you can see my screen, Raja, and you can hear me.
Yep.
All right, because otherwise I'm talking to myself. Hi, everybody. I am going to speak about the qualifying exam, talk briefly about the nuts and bolts of the exam itself. Some of it is a little bit of overlap. I tried to remove some of the overlap from what Dr. Hahn and Dr. Pei had talked about. And then I was asked to talk a little bit about how to prepare for this exam. So, and I have no disclosures to give. So the general surgery exam admissibility for the certifying exam is that's for the certifying and qualifying exam. You have 7 years from completing residency to achieve the overall certification. And then, as Dr. Hahn had talked about, you have 4 chances in 4 years for the qualifying exam. So you basically have one chance every year for the qualifying exam in order to pass. You should apply after the completion of residency to ensure maximum opportunities to take the exam, and the test is usually given in July, as Dr. Hahn mentioned. She also mentioned that there is an option to take it in the PG4 year with an exception request from the program directors, but the bottom line for the QE is to register and take the exam as soon as you are ready. So if you're ready in your PGY4 year, you've completed FLS, FBS, and all the other factors, then I would go ahead and register and take the exam. On the exam day itself, you would be taking this at a center, and it's an 8-hour computerized multiple choice exam. It's taken at the authorized testing centers only. And then each of the 4 sections, you have about an hour and 55 minutes to take. And there's a 10-minute break, a 40-minute break, and a 10-minute break in between. Of the 300 questions, there's 75 questions per section. And then once you finish one section, you cannot go back to the previous section. So finish up the section, go back and make sure that this is a way that you want to answer the questions, and then you'll go on to the next section. There's a scaled score, and the passing score is at 400. And wanted to emphasize that, again, from what Dr. Hahn said, the qualifying exam is similar to the ABSITE exam. So when I'm often asked on how to study for the qualifying exam, mine is to start from the very beginning, start when you can. I always suggest that you start studying for the ABSITE exam on day one of your residency, and that is the best way that you can study for the qualifying exam. And another thing that's really, really great, and Dr. Pei mentioned a little bit about this, is that the ABSITE is mapped to the SCORE curriculum. So if the ABSITE exam that is taken every year in your general surgery residency is similar to the QE, then you are already studying every day, hopefully, of every year of your residency. The content of both exams, the QE and the CE, but specifically here, the qualifying exam, is on the American Board of Surgery website. So 80% of the exam is patient care, and here are the breakdowns. This is taken directly from the website. So that the surgical subspecialties are 4%, and the rest of them are listed here. 20% is medical knowledge, and of the section on medical knowledge, you have applied science, and then you have preoperative evaluation and perioperative care, and then you have miscellaneous topics. But the majority of the QE is on patient care, which is great because that's what you'll be doing during your residency and are doing during your residency. So that is kind of what the exam is about. And as far as talking about the study strategies, to me, the most important study strategy is to study throughout the year, every year, and not to leave the studying for the qualifying exam toward the end. And to kind of set that up, I'm going to quote a couple of studies that I think help toward the paradigm of continuous study, which is that the American Board of Surgery in Training exam, or the ABSITE exam, is more predictive of passing the QE and is not predictive of passing the CE, or the certifying exam. And on this study by Dr. Malangoni and et al., that the better that PGY-5 performed on the in-service training exam, it predicts passing the qualifying exam. So if you study every year and you don't blow off the last year and you take it seriously to study, it's a good way to kind of see how well you're prepared for the qualifying exam. And if you look at the categories on the ABSITE exam, on the left of my slide, and the right is the QE, they're very, very similar. Patient care is 72% on the ABSITE, 80% on the QE. Medical knowledge is 24% on the ABSITE, it's 20% on the QE. And so the ABSITE was geared to be similar to the certifying exam, and the ABSITE study can be done with the SCORE curriculum, which most residency programs are now using or subscribed to. So moving on to what your residency programs hopefully do offer during their education program or the curricula in the form of ABSITE study. This study by Dr. DiVirgilio and his group over at UCLA Harbor, they looked at different programs or in different ways that people studied in their programs in residency and what influenced the scores for the ABSITE exam and which did not. And you'll hear this common theme, which is that tracked reading throughout the year helped scores on the ABSITE increase. Remediation programs, which are basically consist of time during the year to study, and study plans are usually followed throughout the year, help influence scores. What do not help influence the ABSITE scores are number of education hours per week, the frequency of ABSITE review sessions during those education times do not influence scores. So again, to study throughout the year is probably the best suggestion that we can make for you to study for the qualifying exam. On Dr. Turner et al.'s study on study strategies, when he polled residents on what their strategies were and what worked, what they found out was that spacing the studying throughout the year helps, and that so implementing a schedule and then testing, self-testing, looking at those scores, and then guiding your study throughout the year with intermittent testing is probably a high utility study strategies. And then which worked for most of the residents when they correlated how well they did on the exams. So study activities over time is a high yield study strategies for the ABSCITE, and therefore probably for the qualifying exam also. On the same study, when they looked how much people had to study throughout the year, it would be 120 minutes per week studying, which would also, which is a better utilization of time than spending 420 minutes a week in the month prior to the exam. So again, the message would be to study throughout the year and not try to cram at the end. And then when you're trying to find out about a subject that you're learning for the first time, the majority of residents use textbooks for that, and then review books and question banks after that. But if you're learning something new, you should probably study with a textbook and then back it up with review questions and review books after. As Dr. Pei mentioned, there's tons and tons of resources for studying for these sets of exams, especially for the qualifying exam, which there are numerous textbooks. There's a couple named here that used to be suggested as a way to kind of guide your study throughout the year. There are broad review books that these are just but a few. And then there are systems, which are virtual courses that are offered also. And then the SCORE curriculum is an amazing way to kind of guide your study throughout the year for the ABSCITE as well as the QE. There are question banks also. They're available on SCORE and on TrueLearn. Dr. Pei mentioned CSAP, which is a question bank and guided learning that way. And then there is the ACS Comprehensive General Surgery online review course, which Dr. Pei also mentioned. So the assessment of general surgery residents and study habits correlated with correct answer and percentile rank on the ABSCITE. So this study, basically the point I wanted to make is that question banks do work if you use them throughout the year, not just cramming, and if you use them regularly. And so for TrueLearn, this study came out, which said that, and it doesn't really matter which question bank you use. I think the point is that if you use all the questions on a question bank and you use them throughout the year, that you can increase your ABSCITE score, and you could probably do well enough to pass on your QE also. So that the point is that you have to use the question banks in a protracted way, and you have to also pick those topics that you didn't necessarily score well on, and to inform yourself on those so that you're building on your studying and not just go blowing through questions and trying to see whether you achieve a particular score. I'm going to end up just with a couple of slides about the SCORE curriculum. Now, you can design an ABSCITE study plan using SCORE. So this was from one of my residents here at Loyola who showed me how to do this. And so these screenshots are made from him, so because otherwise I wouldn't be able to get on there. So go on to the SCORE portal. Once you log in with your username and password, and most residency programs provide this for residents, so hopefully you're in one that provides this for you. And then when you are on the assignments page, you will click on assignments to get on the assignments page. There's a sub-tab that shows you how to create an ABSCITE study plan. You're going to go ahead and click that. And then you can go ahead and assign due dates to yourself. And when you assign due dates to yourself, you can also pick the topics that you want to study, or if you want to use question banks for, then you can go ahead and assign those topics for a particular date and plan this out throughout the year, culminating in your ABSITE and hopefully culminating in your qualifying exam. The best way to kind of use this, from what my resident had told me, is when you get your score and you have the topics that you don't necessarily do very well on, then you can go ahead and program this in so that it helps you with the following year on the ABSITE. So if you do this 5 years in a row or 7 years in a row, or then you will be able to build an accumulated knowledge to help you with the qualifying exam. And then this is what it kind of looks like. It's due on a certain time. You have these boxes to check. You go ahead and study material, and you go ahead and take the sample questions for the ABSITE on these particular topics, and then that helps you study or help guide your study throughout the year. So take-home points of studying and preparing for the ABSITE is the best way to probably study for your ABS qualifying exam. Tracked reading and tracked question taking throughout the year is probably the best strategy, and it has been shown to be a high yield study technique in spacing your studying. And then self-testing with question banks is high yield if you do that often and you do that throughout the year. And then remediation programs are basically monitored and tracked reading and question bank programs. So that's why remediation programs do work. Thank you for your attention, and I appreciate it being invited to be part of this panel.
Perfect. Thank you so much, Dr. Lau. That was really excellent. I really appreciated that walkthrough as well, because I didn't know you can do that through SCORE, and I certainly utilized it a bunch in residency, and I still use it now for the CGSO course. So that's awesome. Thank you for that. All right, so we're going to keep going. We have our last speaker up, and then we're going to open it up for Q&A at the end. Our last speaker is Dr. Eliza Beal. She is an assistant professor of oncology and surgery at the Karmanos Cancer Center and the Wayne State University School of Medicine. She completed her general surgery residency and complex general surgical oncology training, as well as a Master's of Science and the Pelotonia Postgraduate Fellowship, all at the Ohio State University. She is additionally among the general surgery faculty for the Osler Institute General Surgery Mock Oral Exam course. We're very lucky to have her present on how to prepare for the certifying exam. Take it away, Dr. Beal.
Hi, thank you so much for having me. My first piece of advice about preparing for the certifying exam is to not do it in light like I have right now. So I'm so sorry. I am working from home this evening. So you've heard a few nice talks already. So I'm just going to give you a few thoughts specifically on the certifying exam. This is a very different test than the qualifying exam and then the ABSITE. My only disclosure, as Raj already mentioned, is that I'm a proctor for the Osler General Surgery Mock Oral Exam course. This is just one of several courses that are available to prepare for the certifying exam, and later I'll mention a couple of the others as well. I also wanted to say thank you to Dr. Vreeland, who has given this presentation in the past and from whom I borrowed a significant amount of material and then added my own thoughts as well. It is my and many others' opinion that the best way to prepare for the certifying exam is to be a good resident for 5 to 7 years who reads, studies, sees a lot of patients, and does a lot of operations. If you're taking the certifying exam this fall, this probably isn't what you wanted to hear, but in general, if you've been doing this throughout residency, the certifying exam is not that difficult. If you're a junior resident on today getting prepared far in advance, this is something you should get started on right away. But if you aren't, and really no matter what you've been doing, there can be a lot of anxiety associated with this exam. So if you didn't do that, or you did, but still feel unprepared, I have a few thoughts. So to describe the certifying exam in general, there are 3 30-minute rooms. They obviously used to be real rooms in a hotel, but now they're virtual. There are 2 examiners per room, and each room has 4 scenarios that last 7 to 8 minutes. The more that you practice, the more that you will be comfortable with how awkward the exam feels. You'll get a score for each scenario and a score for the room, and then a composite score for the whole exam, which is essentially pass-fail. It's important to know that you can fail a scenario and still pass the room, and you can fail a room and still pass the test. It's important to know this because a mistake that people often make is that they do poorly on a scenario or in a room and have trouble recovering. So one first initial important piece of advice is that when a scenario is complete, no matter how well or poorly it went, it's important to fully mentally move on to the next scenario. Don't go back in your head and try and correct your mistakes. It's a short test and a short period of time in your life, and you have to stay in the moment and focus and refocus on the case at hand. So the first certifying exam is not the ABSITE and not the qualifying exam, and you have to study for it differently. It's not a fact-based exam like your attending's pimping you in the operating room. You have to play the game that the examiner is playing. And I think the best way to do this is to treat it like a conversation in the surgeon's lounge, like someone is coming to you and presenting a case and they want your thoughtful opinion. You can pretend as if you're discussing a series of cases and providing your thoughts on how to manage those patients, to a trusted colleague that you regularly communicate with. You should also keep in mind that you should usually say what you would do in real life, except sometimes when you should do the slightly safer thing. One example of this is that people who actually know too much about a specific topic can get themselves in trouble because they know the latest approach, which isn't very standard and isn't in the guidelines yet, and the examiner is looking for a more textbook answer. Another specific example of this can be naming a specific trial, but then not knowing quite all of the details about the trial. So in this case, it's okay to just say that there's randomized data to support something. So when you don't have it nailed down, keep it vague. As an aside, you won't ever know which scenarios or rooms you passed or didn't pass. So this is just a simple suggestion of how to get ready for the exam. We'll go through each of these in a bit more detail, starting with making a plan, as was mentioned as a key for the qualifying exam as well. So the first step is to make a plan. You should create a realistic calendar to cover everything twice. I'm sure you guys already have done this for other things, but you can do this in Google Docs or an Excel spreadsheet, and plan how you're going to cover everything and plan to spend more time on areas where you are weak. If you are planning to take a review course, you can fit that into the study plan as well. The plan should be realistic, laying out which topics you're going to study on which days, but also leaving time to catch up if you get too busy one day. And then once you've made a plan, stick to it. Don't get super caught up in one topic. For example, reading all 286 pages of the NCCN guidelines for breast cancer, unless you're a very fast reader. You don't need to know every single detail of every single topic. You just need to pass every topic. My experience was a little unusual because I was part of the class where our qualifying exam was made virtual, was over 2 days, and was canceled in the middle. So I won't tell you too much about my own specific plan or how it got foiled. But just from what I've heard from people who had a more standard experience, some folks do consider taking a week or two off before the exam to study. If you'll be very busy clinically or academically in fellowship, for example, in the time around the exam, this might make sense for you. You should start comprehensively. You can use a review text or some source that is comprehensive. There are books, and some of them have been updated, but some of them are pretty dated at this point. I personally used How to Win while I was a surgery resident preparing for our institutional mock orals. This book was great because the day before I would sit down and read the entire book from cover to cover. It's very readable and is presented in a case-based kind of conversational format. I used clinical scenarios in surgery in a more detailed way while actually preparing for the exam, and felt that one was especially helpful in concisely describing operations. Passing the general surgery oral board exam can also be an excellent resource, but is a little bit of an older text. And then there are also several different types of courses available. So there is a Behind the Knife general surgery audio oral board review course that have podcasts on all of the topics. I don't think this existed when I was studying for the exam, or at least I didn't know about it. But I did read their website, and they go over 92 scenarios to cover the 115 score core topics. Another example is the Osler course, And I think it was already mentioned once, but the American College of Surgeons has a comprehensive general surgery review course that they're offering annually as well. Doesn't matter which source you use, but that you pick one and use it to help you cover each topic, ideally twice. You should also make sure that you're going to nail common scenarios, especially in areas where you are weak. For example, in vascular surgery, it is more important to know how to do an SFA bypass than to be able to describe a TVAR. As we mentioned before, this is not a fact-based exam. So while you're studying, focusing more on algorithms or scripts, thinking through the script or writing down a script rather than on detailed facts will be more helpful. And again, the books I mentioned, Passing the General Surgery Oral Board Exam and How to Win, are both set up this way as a script or conversation. The next important element is test-specific practice. So this can be going over scripts in your head or writing them out while you're on your own. But I would argue that the most beneficial thing that you can do is practice. You can ask faculty within your own program to help you out with this. Most of them have probably done it before as mock oral board examiners, at least, and they will be happy to help. I personally set up appointments with faculty in areas where I didn't feel as strong, trauma, critical care, and vascular, and they went through scenarios with me and gave me feedback. This can be done in person or over Zoom. If you want to mimic the actual exam, I think at this point it makes more sense to do it virtually. You can also set these up as group sessions with multiple residents included, and you can also ask faculty outside of your institution. There are also several courses and web-based apps where you can get additional practice, although these do have a cost associated with them. The next important step is to figure out where you are weak and focus your efforts there. For example, I hadn't rotated on vascular surgery in several years by the time I took the exam, and it wasn't my favorite while I was doing it, so I knew this was an area where I would be weak. I also came from a program, as probably many of you do, with a limited amount of penetrating trauma. So these are areas where I knew I had to spend a little more time. It's important to think about and ask the people that you practice with for feedback on how you present yourself, your tone, and other stylistic points, as well as the quality of the answers you provided to the scenarios. Once you have identified your weak points, you can focus on the most common 2 to 3 scenarios from these weak areas, instead of trying to cover the entire topic of, for example, vascular surgery. The goal is to pass each scenario to give a passable, reasonable answer. You should focus on giving a safe and reasonable answer for every scenario and don't chase the rare topics. I'd be happy to answer any questions during the Q&A or via email.
All right, perfect. Thanks so much, Dr. Beal. So now we're just going to take a few minutes to answer any questions that may pop up in the Q&A. So I'll keep monitoring that. You can answer some questions there. Let me just start by asking Dr. Beal, since you're still here with us on the video, just as your experience of being a mock oral examiner, are there certain things that you've noticed from people that have gone through the course that they tend to perseverate on, or tend to be things that people will waste time on when, in fact, there's a different structure that they should focus on in your experience?
Yeah, I do think one of the things that the Osler course actually does a really good job on is providing a format for answering the questions in a way that's like makes it comfortable. And so I think by the time people get to the practice sessions for the Osler course, when they're taking the course, they usually kind of have that down. But so I do think that's one advantage of taking one of the review courses. But another thing, I think, like if I was trying to pick out like a few things that people do that I usually end up giving them, giving them tips on, would just be slowing down. So you don't want to take too long to think about the answer to a question, but you don't want to just say the first thing that pops in your head every time, especially when it gets to kind of the more challenging points. So taking time while you're answering the questions to take 1 second to breathe and think before you speak is one. And then another is there's a balance between like confidence and cockiness. And so I think as you know, just as a mock oral board examiner, the best people at doing scenarios, they come across as confident, but not like they wouldn't listen to an alternate opinion if you offered one. So those are kind of two first thoughts.
Got it. Okay. As I'm waiting for some other questions in the Q&A, one question I had for Dr. Hahn, perhaps for the juniors that may be in the thread, is if there have been any conversations about how the new consideration of EPAs that are folding into general surgery residency programs may be projected to impact how applications are compiled before people sit for the QE or the CE exams, or is that much further out?
Yeah, so I think definitely that's kind of further out. I mean, we think it's going to take a while for EPAs really to get solidified in residency training, but you can imagine you probably have to complete your 17 or 18 EPAs in general surgery before you can sit for the qualifying exam would be most likely. And ultimately the goal is to shift from time and numbers, like, so 60 months and X number of cases to competency-based education and in assessment. So I think to be determined, but I will probably shift as that will be the requirements in addition to a few other things. Yeah.
Right. And then one question just for everybody as well is, maybe if you've had the experience of a trainee in the past that had failed either the QE or the CE, and I guess this would be a good question for Dr. Pei, but I know he had to leave for a case that was starting soon. But if you've had someone that's failed in the past, is there usually a go-to person depending on where they're at in their stage of their career that they should reach out to first? Because I would imagine if you're a PGY4 that doesn't pass the QE exam, your program director would be incentivized to help you because they want to make sure that you pass and can complete your residency training. But if you take the QE after you're a PGY5 and certainly the CE exam, you're no longer part of the residency program. So is that something that you want to discuss with your fellowship program director if that's where you are at, or your colleagues or the chief of your division if you're a practicing attending? Just wondering if you've kind of had that experience with colleagues in the past or trainees.
I think this is for everybody. So I'll just give a brief answer. In that, I think Kevin gave really good advice. There's, none of us ever want to fail. None of us think of ourselves as failures. If you fail an exam, you're not a failure. You just didn't hit the mark that day, and it doesn't mean, most people ultimately pass their exams. It's very rare for people to struggle and get through, and people who fail the QE are not necessarily, as Jim Lau said, not most likely to fail the CE. It's testing two different totally type of exams and two really purposes in terms of knowledge versus judgment.
So to answer your question, Raja, I have had people reach out even after they've left the program. I think the most important thing is to reach out to somebody who's going to help you decompress, kind of put things in perspective, and then a mentor either from your residency program or even outside your residency program and your fellowship program that you feel like can help give you advice and ground you and help you put a plan together throughout the next year to be able to study for either the QE or the CE. They're both much different tests, so the study strategies are a little bit different. With the certifying exam, is probably just practice, and you can reach out to a whole bunch of folks. I've had a couple of past residents just want to do Zoom sessions to concentrate on certain scenarios that they think that they have trouble with. And that's pretty nice. But also I would say to talk to your fellowship director if you're in a fellowship so that they know what you're going through, so that they can help you have some protected time or some time to study for it. Because I think what Dr. Beal had talked about is formulating a plan, having some time, and then sticking to a plan is important. And if you don't have the support of your fellowship director for that time in order to remediate and to pass the second time, which is going to happen, then I think it's important to get the fellowship director involved or your new boss if you're in a job. Just my 2 cents.
Great advice. Thank you. I think that covers the questions that I saw in the QA so far. So if there aren't any other questions, a copy of this recording will be on the SSAT YouTube site, as well as the slides that were presented here today. So I want to thank all of our speakers that spent their time putting together their presentations and being here with us today and answering questions as well. And thank you all for joining as the audience. Really appreciate it. We'll give you guys back about 26 minutes of your time. So take care.
Thank you.